A national study released just a few minutes ago is raising concerns about U.S. News and World Report's hospital rankings. Health reporter Alicia Booth is here now with this exclusive story. This is something they've been doing for, nearly 20 years now.
Oh, absolutely. And a physician at Metro Health Medical Center and Case's School of Medicine was curious about how reliable the magazine's rankings are. He says the rankings are actually a poor indicator of hospital quality and not reliable for the patient looking to make the best choice.
A top ranking by U.S. News and World Report is a coveted distinction for a hospital. You can figure that out by all the advertising you see around Northeast Ohio calling attention to those rankings. But kidney specialist Ash Sagal wanted to know how much reputation had to do with those rankings as opposed to hard evidence. His study in the Annals of Internal Medicine shows the top 5 hospitals in each specialty are there by reputation alone. 100%.
If we did the same thing with, say, professional football teams, we would decide, let's just give the Super Bowl trophy to the Dallas Cowboys, because without making them play any games, because they have a reputation for being, they have a national reputation for being a good team.
Dr. Sagal says this is not a reliable way for patients to choose where to go for medical care.
I think that we want to be selecting hospitals based on data, based on research, based on evidence, and not based on subjective measures like reputation.
U.S. News staunchly defends the way it ranks. A spokesperson says the doctor surveys identify the hospitals with the best care for patients who have the most serious or difficult medical problems. All of the local hospitals ranked in the top 50 use the distinction as a marketing tool to attract patients. As for the Cleveland Clinic, widely advertised as U.S. News' #1 heart center year after year.
Reputations don't just happen. Hopefully, good or bad, they're earned.
Chief Medical Operations Officer Dr. Mark Harrison says the clinic's reputation is due largely to things like good service and outcomes, as well as strong research.
I hope that means that we've earned the respect of our patients and our peers.
I also spoke with university hospitals, and locally everyone agrees as patients we should rely on more than one source to make a decision about where to get our medical care. And I am posting everyone's full response to this controversy online on Newsnet5.com. You can also see what Dr. Sagal recommends we use as criteria to make our own decisions.
Yeah, not one magazine article, certainly.